Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started.
Welcome back to the Whole Health Podcast. Today, I am so excited to have as a guest a good friend and also my CFO and CPA, Jeff Gullickson, to talk about the idea of financial health. And before we got started today, we were talking about finances, does that really relate to health? And then we got to talking about how do we all feel back in 2008 when, the economy went in the toilet and, stress, that definitely impacts health. So Jeff and I have worked together for about 8 years now, I think, right, Jeff? Something like that. Yeah. And I've got to say, Jeff has great perspectives, not only on fiscal responsibility and how to be financially savvy for the better sake of your health, but you also have a great sense of humor and you're a great writer. And I'd love for us to start today by you sharing with us, how did you get into the world of finance? What was your path? And we'll just start there.
Yeah, so kind of entrepreneurship was my first foray into things. My first business was selling lemonade when Mount St. Helens blew up in May of 1980. We sold it down the street.
Wow.
As all the tourists stopped on I-5 and watched the mountain blow. Learned that, you don't get to keep all the money that you take. You have to pay for the lemonade that your mom bought for you too. So
good lesson for mom.
Yeah, thanks.
Yep. So from there, ran a photo studio for 6-7 years. Discovered I liked doing my price list more than taking the photos, so I switched into accounting. My wife's a physical therapist, helped her with her practice, and then kind of just stumbled backwards, friend of a friend, into the dental world, and I'm kind of a dental CPA now. So yeah, that's how we got here. So just a passion for entrepreneurship and helping small businesses succeed. So is the core. So.
And I will say that you do that incredibly well. And anybody who gets to work with you is very fortunate.
Thank you.
So as it relates to financial health, I'd love to get your perspectives because you oftentimes, and we have had many a dinner together, and you've shared we started with a practice who was kind of here, and we helped them do this and that. But how do you perceive financial health?
So yeah, it's each one's individual. Mm-hmm. And got a couple books that I usually always give new clients, and one is a Simon Sinek book, Know Your Why. And it seems, and that is not a financial book. It's a goal book. It's finding out what you're at, examples of Apple, everything else like that. But for financial, when I'm helping out entrepreneurs, they can tell me a number and I can get them to that number, but then they're usually not happy when we get them to that number. Or they just struggle to get to that number and then they feel depressed. And then, so that's not good health. But when you know your why, just when you see a patient, either of you, and they're like, I'm struggling in this, I want this. And they give you health, or I don't want to feel like this anymore. And that's kind of what I would say financial health is. It's having a plan and that to get to that stability of where you're at these days. So, yeah.
So when you start with, I've actually never heard a CPA say that they give their new clients books, but I love this so much.
Yes.
It's very similar to how we are.
Yeah.
So you start with a new client, you want them to establish their why. You're going to help them map it out. I imagine where they're, how they're going to get to where they want to go. But can you say a little bit more about the why? Is the why I want to make $1 million because I need this, this, and this in my life, or I need this sense of stability, or what is a why when it comes to financial health?
Yeah, so and a lot of it changes throughout your life. So you're always, get a young doc just out of school, might have a girlfriend. His why at that point is, I have student loan debt. I have this practice purchase debt. So my why is I want to be debt free.
Got it.
That's my financial step. That's what's keeping. The other question I asked was, what's keeping you up at night? What's causing that anxiety? So that's financial health, because everybody. I was pulling some stats last night. 80% of people feel financial stress. 60% say it's debilitating.
Wow.
And so the answer to that, a lot of people are like, well, if it's debilitating, I just won't think about it. And then so that creates a cycle where you're just constantly making bad decisions and you're digging your hole deeper. So helping people get rid of that anxiety that's keeping them up at night is financial health, essentially. If you have a financial advisor, if we can dig in the numbers, get nerdy, like, okay, you have these goals and this is the number that's going to get you there. And but that's not financial health as far as like what people should be thinking about every day.
Interesting. So thinking about financial health isn't how you are looking at their balance sheet. It's really how they feel well and safe in their body. What does that look like in their financial world so they can sleep at night, so they can accomplish what they're trying to accomplish for that sense of safety.
Yeah.
Wow.
Yeah. Yeah.
It's interesting because the numbers that you just shared, I'm like, wow, that sounds a lot like dentistry, which then I was kind of thinking about, well, what's the core issue there? And I suspect that a lot of people perhaps feel out of control, or maybe they don't understand the tools in their toolbox, or maybe they haven't been coached well to know how to develop agency over how they can affect change. Because just like you said, well, then the solution to that 60% who feel debilitated is I'm just going to avoid it. And I mean, I can't tell you how many people I've met where it's like, I'm really embarrassed to say, but it's been 20 years since I went to the dentist. And to your point, like there's probably a lot of people who, out of avoidance, just like I don't even think about it. And it's like, that probably, I'm guessing, doesn't lead to the healthiest place.
No. Yeah. So, yeah.
So I'm curious, like, do you have some stories, not naming names, of course, where like you worked with people where the stress of their finances was creating debilitating situations in their practice, in their professional, in their personal life even?
Yeah, I think a lot of in healthcare and in our business too, a client, a patient has a pain point. They come to you with a pain point. It can be pretty specific, it can be pretty general, but one of our big pain points is I'm paying too much taxes. So, part of my job is tax accounting. So we can, if that's the worst thing that's happening to you, you're probably in pretty good shape. But that is a pain point. That is anxiety. That's one that we've seen. More often than not, though, it's just like I feel like I'm working my tail off, but I just can't figure out how to get ahead and what am I doing wrong. And this is in the practice, and then sometimes it can be in the personal life. So then that's kind of where things are at. Interestingly, I had a client, no names, who told me the other day that he'd always had a goal of owning a supercar. And like that was his ultimate goal, and we're struggling to get him out of debt right now. But that was his thing, and it keeps him up at night. I'm never going to own this supercar, and he felt like he was a failure. And he finally had this epiphany, I think, on a vacation or something like that. Like that's not what's bringing me happiness. Like that's somebody else's goal and not my goal. So going back to the why of identifying like why, a lot of it is just sitting down and talking to people like, what is your why and what do you want to do with your life? Do you have 7 kids you want to get all through college? Do you have 1 kid that you're going to make pay for college themselves? Do you guys want to do this? What does this look like? How's your health? Can you practice until 65? Do you love practicing? Do you want to practice till you're 65? All those things. So yeah, just like you guys talk about, like each patient is an individual, each client's an individual. So, yeah.
Go ahead, please.
I think in my very rudimentary understanding of what a CPA does, because I don't do that part of my life, thank goodness. Yeah. I always think of CPAs as coming in after all the decisions are made and sort of, documenting it and making sure you're ready to pay your taxes, which just gave my heart a flutter because that's coming right along with the extension right now. It's almost October. So what you're saying is you're not just doing somebody's taxes, you're having conversations with them about planning. So in essence, you're your financial planner alongside being a CPA. You're doing all of it. You're helping people with their entire financial life.
Yeah, entire financial life, kind of like Kelly, I think I've identified as I call myself a virtual CFO because I'm not sitting in my clients' practices, but I'm there helping them make those financial decisions. And I started out with this idea actually for photographers because I knew that industry, and then discovered I'd have to have 100,000 photographers because photographers do it part-time and they don't make a lot of money. A few exceptions in there between, but just having a business where you can, help them out and guide them through that, and be there for them. Originally, I was traditionally a tax accountant. So CPA, we do audits, we do taxes, and like you're saying, a lot of it is just historical, making sure everything ties and nerdy, get into the numbers, present reports, but they're all historic based.
Yeah.
So what I hated was when I was a tax accountant was somebody coming to me in January, March, September, and going, okay, here I am. And I'm like, well, what did you do there? Why did you do that? Why didn't you do this in December when we could have made a choice? So originally when I kind of was coming up with the business idea, it was more tax advisory, but it's kind of morphed into just full practice in life. Kelly had a big piece of equipment he wanted to kind of, get for his practice to help his patients out. Gives me a little text like, hey, this is what I'm thinking about. This is what we chatted back and forth. There's a thing called ROI, return on investment. So like he presented the case, that's nice return on investment. Let's go for it. And in your personal life, it's a little harder to do ROI.
Right.
Is that dinner out on Friday night? What's the ROI? I got to spend time with some friends and family and that kind of thing, quality time.
Yeah.
So it's not numerical, but it's more of that feeling and having good, mental health. So
yeah, makes sense.
One thing I was thinking about here is that, I bought my practice in 2001 and I was acting as a accountant, so to speak. I had an accountant who was doing the retrospective stuff, but what I remember most about it, it's like looking back on a bad dream, is that I would go in once a month on a Sunday to do the books of the practice, and I hated every bit of it, because I was living the experience of, as a business owner, working, and you're helping people and you're trying to accrue a certain amount of revenue to, meet your goals and such. And then you got to watch it all go away,
Yep.
And it was looking back, I realize how much of my energy that I could have put somewhere else was being spent on something I didn't like doing. And from a health standpoint, let alone the growth of the business we've experienced since we started working together, it was really a tax, because I wasn't enjoying a minute of it. And, I guess my point of mentioning this is for, people listening, if they feel stress about finances, that there are healthy ways to engage with professionals who will free up your energy to do more of what you love doing, and you'll probably be more productive and profitable in your life in many ways, not just financially, but that certainly has been my experience. But thank you for sharing the bit about starting with the why, because I think we were talking earlier about my book and the concepts of what are your goals. That's how Megan starts her conversations with her patients and clients. We do the same at BDC, and having worked with you, I know that's how you work as well. Is like, and every year it's have your goals shifted?
Yeah.
Which for people's health it does as well. And what I love here is we're talking about how your financial life ties into all of this. What are some of the steps as you're working with your clients that you feel like these are the however many, 2 things, 5 things that you're like, I love knowing these things about my clients so I can better step into their health experience in life because we're doing these things?
Yeah. So knowing their why, knowing their goals. So we set, we always do like a 3, 5, 10 we've done with you guys. They say 1 year is too too close. Like you should already be knowing what you're going to do. Goals are so you can set what you're doing every day. So you should already be doing that. But that 3-year window is close enough where you're like, if I'm going to get there, I need to do something today, or what am I doing today? 5 years, kind of like this, traditional metric. 10 years is kind of that long-term planning. It's kind of a dot on the map. You might get there, you might not, but it's a good direction to go. And then just understanding the dynamics. Sometimes, like you guys experience, you're kind of a counselor with understanding. A lot of the practices we work with are husband-wife. So either they met in dental school and they have their own practice together, or like Kelly's office, like where his wife is the practice manager, and there's a lot of interaction there. So just making sure everybody's on the same page and balancing out the personalities and what everybody wants in the situation. My wife and I deal with this like once a year. We set aside a weekend and we go off and we do our 3, 5, 10. We do a financial review. We do a kids review. Those are the types of things I want to know about my clients. So I can help them make the decision, because they're then, if Kelly wants to come buy, big piece of equipment, I'm like, but we talked about you doing this and taking that money personally to do this for something else. What does that look like? So understanding that whole goal of what they really want, because there's always that big shiny thing out there, no matter who you are, that's kind of, that can either get in the way or be the one thing you have a goal for. So, yeah. Did that answer your question?
Yes,
Yeah,
very, very
okay.
beautifully. Might be a shiny horse.
I really want a new roof on the barn right now. And every time I walk outside, my husband says to me, someday, honey, we'll get the new roof on the barn.
Yeah.
It's not a diamond ring, babe. It's just a roof.
Yeah.
Oh, I love it. I love it. So how do you feel like, let's say there's folks out there listening, they're like, I never even thought about how my finances impact my health. What are some things you'd recommend that, like, where do they start in considering their, like, how they can elevate their life experience through financial planning?
I'd say the first thing is 2 things. It's educating yourself a little bit. Think about this, because my wife and I have been going to the gym for about a year and a half now, pretty regularly. And we've done it up until this point just on our own, and educating ourselves. Okay, this is the workouts. We got found a good app. She has one app she likes. I have another app, so we don't work out together. But then, so educating yourself about it, and that'll help you just understand and release some of that anxiety that you might feel about the money. But find something that works for you, that fits for you. And then once you got that, then try to find a good team around you. Try to find a good CPA or tax preparer. Try to find a good, if that's your pain point. Taxes are so complex these days, and they're only getting more complex. So an individual trying to keep up with tax law and understand, and even if you use TurboTax, like, you still got to know which box to push and which checkbox and what they're talking about when they ask you a question. So the more complex you get. And then, good CPA, good financial advisor, if you have some investments to invest. So, but educate yourself first is step 1.
So how would one go, asking for a friend, just saying, how would one go about that first step of educating themselves?
That's a great question. So if you're a business owner, more and more businesses or CPAs are going into, like we do, like a industry. So we dive deep into an industry. So that's what I would do. Is first thing would be is just Google what your industry is and CPAs or advisors that help in that industry specifically. I met a guy the other day that did something weird. It was like, I know some people do online selling, some other stuff. Oh, it was golf caddies. So he is
wow.
a CPA for golf caddies.
Wow.
And talk about weird, because, I mean, the big golfers, they have all their money, but these guys make millions of dollars. They get a percentage of the winnings. And he just knew a friend of a friend and started doing it. But those guys travel all over to different countries, different states. Sometimes they make a lot of money, sometimes they don't. And so just a niche little thing. And so he, does taxes for 50 professional, caddies on the PGA Tour. So
Fascinating.
Yeah, so that would be the first step, and then just asking friends, maybe in the same industry. With cloud-based software, we have clients here in Portland. We're down in Bend, but we have clients all over the Northwest and even back East Coast. So we can do our job from anywhere. So
If you're a patient or a patient, everybody's referred to as, if you're a human listening to this right now, that is thinking to themselves, man, my finances really stress me out. And I know that's a big part of my overall sense of health. And they don't own a business or they're not looking for something specialized. Do you have resources for people just thinking about, I just want to increase my IQ around financial health as it is, like a book you would recommend or something like that?
Maybe even like, who are some good thought leaders out there that you respect?
Yeah. I was going to say, stay off random TikTok and random Instagram, because you'll see all kinds of crazy stuff there.
Just like in our fields.
Yep. So I always forget how to pronounce his last name. Ramit Sethi, I think is his name, Sethi. So he wrote a book called "I'll Teach You to Be Rich." And, that big headline you see when you walk into the bookstore, you go on Amazon, whatever. It's a great book. And his idea of rich isn't money. It's building the life that you love and how to get there with the money that you have. And he's got some great steps. Traditionally from my generation or generation before me, it was Dave Ramsey. He was always the guy.
Yes.
Dave Ramsey. And he still has a great, I think he's still with us, but I think he's pretty much moved on. But they have a great organization that does the same type of thing. But I would really suggest Ramit's book. He also has an Instagram page and a little YouTube you can watch too if you want to get on that. He had a Netflix show for a while, but I haven't seen it for a while, but where he would go on and help people. So that's also a good way to check out his YouTube page, and because it's always nice to know, those people are in worse shape than I am and they're getting out of it.
Yeah.
And so
there's hope.
There's hope.
Yeah.
We all need hope.
There's always hope. If you got a plan, you got a hope. So
okay, that's great.
Yeah. So I would suggest that one. That's a great book. So yeah, and he has a step ladder system, so you can find yourself in the ladder. Actually did a presentation to Kelly's whole staff based on his 6 steps to personal financial health. So really, and it's super easy, well written. So one of his core tenets is spend extravagantly on the things you love, but cut mercifully on the things you don't. So he particularly loved travel. He didn't care about houses. So he was in an 800 square foot condo in San Francisco, but he traveled for 3 weeks at a time on extravagant 5-star traveling. So his travel budget was actually, I think, 5 times what his, rent was.
Wow.
Where other people go and they spend 50% of their income on their rent. Well, that must be what you love, because that's where you're spending your money.
Right.
So just kind of helping you through that process.
That's a good perspective to have and to really get clear on what brings you joy and put your resources there. I like that.
So what habits could somebody do today? Like, they're listening to this, and again, maybe they haven't, thought much about, like, how can I be intentional with my finances? What habits could people start practicing right now that would help elevate their health experience through financial wellness?
Number one, I would say, is automate. So federal taxes have been around for just over 100 years. First couple of years, they put them in early 1918, I think, somewhere around there. You owe taxes. Here's your bill. They had a lot of problems collecting. So they created basically what we all know today, federal withholding. So, you get your check and there's a big chunk out of it and you have no choice. It's that number and that's what it's going to be. And so just using that same concept of, we know that if you just say you're going to put this away for later, all of a sudden your month goes by, week goes by, all of a sudden the money I was going to save, I went out to lunch 3 times this week or whatever, that money is no longer there. So first step is automate. So that's like number one, if you just want to do that. Second step would be to tell your money where you want it to go. So, you're automating, but you're also telling it where you want to go. You think, okay, I have $100. Where do I want this to go? Because if you don't tell it where to go, it's just going to disappear somewhere. Maybe it'll make it into savings, but so that's the other thing, is just telling your money where you want to go. And there's all kinds of breakdowns. There's a 50-40-10 ratio that some people have talked about. So 50% is your needs. So that's your rent, your your car payment, your student loan payment if you've got that. Like those things that are there and you've got to pay them. So try to make that 50%. Then originally the 40% that's your fun money. That's, you have that money, know it in your head. Like every month I've got X amount of dollars. That's 40% of my income. And I can do whatever I want with it. One friend of ours doesn't like money. She has a credit card, and her 40% is the cap. She could afford more, but she told them, that's my balance total. Like, so she knows at the end of every month, I can't spend, like it's cutting me off. It's like putting a barrier in the way for her. And then that 10% is savings. As the conservative CPA, I would like to see those little bit of I'd love for that 40% to be your savings and that 10% to be kind of your fluffy wants.
Yeah.
But just finding a spot that works for you so you know where your money's going. So it can help you really reduce your anxiety so you don't get to the end of the month and have a big credit card bill that you don't know how to pay. One thing that causes massive anxiety is not having an emergency fund. They say, what was the stat? Something like 80% of people, oh, no, not that high. 58% of people couldn't, if they had a $1,000 car repair today, wouldn't know how to deal with that. Either their credit card wouldn't let them charge it. That's a lot. That's U.S. That's almost 60% of Americans who have $1,000, they wouldn't know where to go with that. So just kind of, that can be refreshing too. That'd be like step 4 in the process, is just kind of squirreling away a fund, an emergency fund. So if something goes wrong, if the roof collapses on the barn, we gotta,
it's a crisis.
Where are we going to find that money? What are we going to do? So
when you broke down those percentages, one of the things I was thinking about that you're sort of speaking to is there's savings for the roof falling in, and then there's savings for retirement, right? Yeah. And I'm wondering with cost of living these days, what are people thinking about? What are you advising people to think about with regards to, yes, you want your savings account, your liquid savings account that you can access if you have an emergency, but really thinking about how you're growing wealth for if you ever can stop working or want to stop working, right? And what are people having to think about these days? Yeah,
and it just depends on where you're at in the process, because if you're young, if you're in your 20s and you're just putting away $500, $1,000 a year, the beauty of compound interest and the power of 7, like we can track it out and show you that you're essentially going to be a millionaire if you just leave that money in your retirement account. So it's almost less about the amount you're putting in and when you start putting it in. So my daughter's going to graduate here in December. First job, hopefully, knock on wood. And, the first thing you're going to do is start putting money into your 401k. We've already got some like retirement funds for them a little bit. We haven't told them about, but they'll learn about those later. Just starting early and then just leaving it alone. Just even at that age, just keep putting money into it and check it once a year. Just to see how it's doing, make sure it's been invested correctly and work with an advisor. Like that's all you need to be doing at that point. You're 40 and you decided to live what some doctors and dentists do. They get out of school. Oh, I've got that DR. I'm going to go buy that Porsche. I'm going to go buy the big house. Retirement, it'll be there. Or I bought a practice and that's my retirement. We see that a lot. And that's just not reality. Especially living that lifestyle that you've built up. You better enjoy this now because your retirement looks a lot different based on that. And so that's a lot different conversation. That's, okay, we need to take a substantial amount. We need to cut your cost dramatically now because otherwise, you're just not going to have enough, and especially if they're a health-minded dentist that's going to live into their 80s or 90s. That's a long ways to go between 65 and 90. So, and we're all living longer these days. So, yeah.
Certainly. Yeah, I'm always grateful. My husband was a finance major, and if it were left to me, we'd be living the good life and never be thinking about the future. And we have a joke in our house when we're thinking about things we can't really afford. We say, well, there's always 59 and a half, because that is, we can hit the 401k. And he's been so responsible that he's thinking about our retirement. I'm like, oh man, I hope I make it to 59 and a half.
Yeah.
It's gonna be a big day on the credit cards for me. Yeah.
Well, one of the things I was kind of taking away from what you were sharing there is like, this isn't really a complex concept, like being intentional with where you're telling your money to go. What a concept.
Yeah. I mean, you guys dive into some really deep subjects, and your chemistry lessons are amazing on your podcast. But in general, like, health shouldn't be in the basics, don't eat fast food every day. Get some exercise. There's some basic core tenets that if you do these things, you're 80% there. So that's the same with what we're doing. Like, if you're just doing these basic things, invest early, tell your money where to go, have an emergency fund, you're 80% there. You're probably going to keep yourself out of trouble. Once you get you want to dial that next 20% in, work with a good advisor, optimize everything you're doing. There's some really great advantages, especially for high wealth individuals in this country right now, to make those advantages. But you can do it. We can get you that extra 20%, but you're kind of in charge of that first 80 in your habits that you make. So just like health. So
yeah, one of the analogies. One of the analogies I was thinking about is like when you go to the grocery without a checklist.
Yeah.
Like if I go to the grocery without a checklist, it's like, oh man, look at this. This looks good. You know what I mean? Whereas when I've pre-thought about what am I cooking this week, what things will I want in order to be able to cook all that, and how much do I need? Because I'm not going to cook for, I'm still trying to get out of the habit of, cooking at home for 4 since it's just Julie and me now. It's like I can get up to the checkout counter and it's like, yep, this is exactly what I planned. How nice. I planned it out. And if I don't plan it, you end up with like a full cart of stuff, some of which is going to go bad. Yeah. And anyway, I was just thinking about like the way you're describing, like, you're 50, 40, 10, if you want to follow that guideline or be more conservative, as Jeff's suggesting, that you already know. You already know what you're doing with it. It's just so simple. And I'm wondering why, more people don't step into it. But
what do you think?
Maybe we haven't thought about it before.
Yeah, what does get in the way? What's your experience of what gets in the way of people doing this more regularly?
An anxiety about money, and honestly, a lack of education of anything. We learn our money habits probably from our parents mostly. Luckily, my mom was really good at budgeting, so that's where I learned probably 90% of my good habits. But you either learn from your parents and you don't like what they did, and then you swing the pendulum the other way. So if your parents were spendthrifts, you become this super saver. Or if you didn't grow up with money and all of a sudden you have it, you never had lessons on how to operate. So I think that's one of the big hurdles, is just that anxiety of like, I don't even know what to do with it. Our kids had an econ class in high school, and one of their assignments was to balance the checkbook. I'm like, this is great. Let me help you with this. Looked at the assignment. I'm like, I don't know what the teacher's even asking. So I emailed her. I'm like, this isn't a balanced checkbook. She's like, oh, I just got thrown into this class because the old teacher quit or something like that. And so these are just some things I pulled off the internet. So that was the extent of their, if without me, hopefully needling them and teaching them some things, that's, the extent of their public education into debt and into balancing a checkbook and spending money and doing that type of stuff. So
I don't think we teach it in school necessarily across the board. I remember my kids having to do some class, I think their freshman year in high school, where they had to calculate out exponential growth. And I remember my daughter specifically coming home and saying, Mom, if I only save $100 a month starting at my first job, I'm going to be so rich. But that was an exercise in really seeing how money can grow, that $100, you're never going to think $100 is going to get you there until you start to see those numbers multiply. So it's a good thing for anybody to see.
Yeah. My daughter came home, showed me that, oh, look what's on TikTok, and showed me that same thing. I'm like, some 30-second video of a guy. I'm like, I've been telling you this for 3 years, but yeah.
Yes.
So,
my kids show me nutrition things on
Yeah.
TikTok, and I have to hold my tongue. Yes.
Interesting.
Oh, how fascinating. Good.
Well, this is the Whole Health Podcast, Jeff, kind of wrap it up. We like to ask, what does whole health mean to you?
I'm going to go back to I write a Friday newsletter, and today I wrote about, I'm going to mispronounce it, longtime. It's a Swedish word that they say is almost unpronounceable and also undefinable, but it's this idea of balance and having a nice balance of everything in your life. Nothing's too extreme, nothing's too, so you have enough, but you don't have too much. And so I think for me, that whole idea of the whole health is that idea of this longum where you're caring for others, you're caring for yourself, you're not being greedy, and you have some goals, but you're also just everything. The money is a used towards your goals and your why, essentially. So yeah.
I love that. Mm-hmm. Where can people find you?
Online at JNG, the letters, not the and symbol. That's always a confusing one. We didn't realize that. jngadvisors.com. Website, you can find us. We have a newsletter you can sign up for, a blog. Also on Instagram, and I think we're on Facebook. But yeah. So
well, and I would encourage all of our listeners to actually go to your website, excuse me, and sign up for your newsletters, because I get, as we all do, we get so many emails, and it's like, whatever, I'm not interested. I've been reading did you start them right at COVID?
I started them in January
of 2020?
Of 2020, and then they became, they were going to be a weekly thing. I think during COVID, I was writing them every 2 days. But yeah.
But they're excellent. I mean, I don't have a ton of time in my life, and I make time to read every one of the ones that you write, because one, you're a great writer. Your images are always awesome, and more often than not, there's some excellent humor in there. Again, you don't have to be a dentist to find great value in what you write. So thank you for the energy that you put into the insights, because they're excellent. And thank you for your time today. I mean, I so appreciate you helping us kind of work into this issue of financial health, how it plays into our whole health experience, and for sharing with us that it's not the most challenging thing in the world, but face it, develop a plan, be responsible and intentional, and hopefully this is going to help some people look into something, much like going to the dentist, that has brought them fear and anxiety in the past, and to see that it doesn't have to. So thank you so much, Jeff. Appreciate
You're
it.
so welcome. So glad to be here.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com, or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.